use that.
Hi there, this is Dr. Dane Donahue, and I am going to go over a report of findings that we do in conjunction with our wellness score and also in conjunction with 8 Weeks to Wellness. The patient that I'm going to go over is literally a new patient that I just had come in this week. He's coming in for his report of findings tomorrow, so we're literally using a live case. This patient was great because I haven't seen him in a long time. He came in with lower back pain radiating into his right side. When I did his wellness score, though, he's a perfect candidate for 8 Weeks to Wellness. He's in his mid to late 40s, and he's got a nice belly on him. He's carrying too much weight, and so I'm going to go over a scenario that I would do, because in my mind this person is a great candidate for 8 Weeks to Wellness. So I created a care plan based on chiropractic recommendations, but I'm also going to recommend 8 Weeks to Wellness to this patient. So recognize that he's already been through day one, so we've already got his goals. You know, we've talked about what his goals are. Obviously he wants to get out of pain, that's what brought him into the office, but we also talked about some of the goals that he particularly had, which was starting to exercise again. He was an athlete when he was in high school, and so he would love to get back to strength training and some of the things that he used to do about 10 years ago. So the other thing is he's scheduled for his WOW. We scheduled on day one his wellness orientation workshop so that he can really understand what his responsibilities are outside of the office to improve his chiropractic care inside of the office. Alright, so what I would do is I'd have Tom literally sitting right next to me so we don't need to waste paper. I'd be going through this on the computer. I'd say, Tom, welcome back. Glad to have you back in the office. I found some really interesting things on your examination and your x-rays that I'd like to go over with you today. Some good, some bad, but that's obviously why you're here. The most important thing I think that you understand is that physiology doesn't lie. So what that means is the data that we collected, it's not subjective, it's not what you think, it's not what I think, it's really what's real, it's what's tangible in your body, and that's what I love about our wellness score. It has no emotions and no opinions, it just needs to be changed. So if there's something that's you're not doing well in, let's just make a commitment that we're going to improve that so you can improve your health, and that's really why you're here. So what I would do is step them through. If you remember, I collected a lot of data on you, Tom. So these were some of the measurements that we collected and I want to go over. Some areas, as you can see on the wellness score, are green and some are red. So some areas you're doing really well with and some areas you're not doing so well with. So I literally stepped through this with him, and basically, let's take a step backwards. I would basically say to Tom, if you remember, we went over our wellness wall here, and I would do this on day one. I go over this with the patient. On one side you'll see a disease. On the other side you'll see optimal health. And your wellness grade is a reflection of how well you're doing between disease and optimal health. So your physiology, your health is somewhere between good or excellent and between chronic disease where you're not doing so good and maybe you're even taking some medications at this point. So then I'll bring them back here. And I like to say that chronic disease is an F. Obviously, you're maintaining health in the middle if you're at a C. And then obviously you're at optimal health, you're an A. And right now, you're not doing so hot. You know, you're a 45-year-old man, and your health right now is scoring an F. And how do we arrive at that? Well, your diastolic blood pressure is 80, which is actually pretty good. Your BMI is 28.5, and anything over 25 is considered overweight. Anything over 30 is considered obese, so you're making your way towards an obese category, which isn't good. Your waist-to-hip ratio is 0.95, and even though you scored a 90 on this, you can see that 0 to 0.97 is normal. So again, it's not so much where you are, Tom, it's where you're trending. And I would venture to say in the past 10 years, your waist-to-hip ratio is probably going up. In other words, your belly fat is going up and up and up. And generally, a patient's going to be honest and agree with that. Your fat mass is 30.4%. So a man your age should have a fat mass around 21, much less than 21%, probably around 16-17%. And your fat mass is 30%, so you're carrying a lot of extra body fat. Your phase angle, which is a reflection of cellular health, is a 7.1, so you're doing pretty good there, but your hydration level is a 56.6. So intracellular water, which is a measurement of hydration, you're not doing so great, and you scored a 40 there. And I would literally step through. MSQ, he did pretty good. His oswestry disability index, he did pretty good, but those are both subjective. His core flexibility, and I'll say, Tom, if you remember, we did 4 core flexibility tests, and we also did 4 core strength tests where I had you moving a lot. Well, guess what? You didn't pass any of the core flexibility tests, and you only passed one of the core strength tests. So it tells me that your core stability, how strong you are in your core, is weak, and your core mobility, how well your core is moving, is pretty weak as well. You scored a 0 out of 4. And these are all basic movements that you should be able to do, Tom. So you scored Fs in both the core flexibility and core strength. Your NSFI, and let me go over this with you, your NSFI is all the testing that we did with this computer here. And NSFI stands for Neuro-spinal Functional Index. So this is how well is your nervous system and your spine functioning. And if you remember my conversation with you, we look for something in the spine called subluxation, which is interference to the nervous system. And if you remember me talking about the nervous system, it's the most important system in the body because it helps you adapt to your environment. So you can't have good health if you don't have a good nervous system because your body's not going to be able to adapt to your environment. So let's go over how you did. And I don't want to do this for sake of time, but I would literally run through each segment just briefly. I would go through his range of motion and show him how he's doing relatively well in his lower back, but his cervical mobility is definitely restricted. I would go through his EMG patterning, how he's getting a lot of right-sided spasm and hypertonicity in his muscles, and then some blips here. So I'd go over that with him. I would go over his thermography. Again, neurologically, we look for balance here, so any type of irritation in the nervous system is going to reflect changes in the blood flow patterns to the spine. So all we look for is colors. Anywhere there's colors, that's usually an area of indication because the nervous system is irritated in that area. And then finally, my favorite, I would go through his HRV. Now, he did a pretty good job, and this is kind of odd because I don't generally see this. Now, I've known Tom for a little while. I haven't seen him in a while, but I know him. And he's a pretty laid-back dude. He's not a stressed-out type of guy. So even though he's not the healthiest of individuals, his nervous system is not stressed all the time because he handles stress pretty well. So he actually did pretty good as an HRV. But a lot of people, I see them come in here where they're sympathetically toned or their overall autonomic function is not really what it should be. So if that was the case, I would go through that with him. But he did a pretty good job in that area. And then I'll go back to his wellness score, and I'll say, so overall you scored a 75 out of 100 in your NSFI test. Your Posture Pro, and I would go over this with him, your Posture Pro, if you remember, I took some digital pictures of you, Tom, and so I'd like to go over that with you right now. So I'd pull up his Posture Pro, and I don't know if you can see this, Dr. Neese, but the Posture Pro here is just a representation of how he's doing as far as his overall global posture. So I would tell them anywhere where you see distortion in the spine, where you see a number, it represents misalignment. So we look for global misalignment, and you can see in your upper back here, Tom, you had 16-degree forward head tilt. So that indicates subluxation in the cervical and upper thoracic spine. So 16 degrees is a pretty forward head carriage. So we're going to see a lot of stress in the neck, in the lower back. Generally, we're going to see a lot of rotation or forward stress on the shoulders. So these are areas that we would see problems. And sure enough, you're getting pain into your lower back and into your right side. And we really feel that it's this global subluxation pattern or misalignment is creating a lot of strain in your body. And then we would go through their X-rays, right? And thanks to ChiroTouch, again, you know, we can pull up his X-rays, and as you can see from his films here, he's got a straightening of the or reversal of the curve in his neck. Now, I knew that looking at his postural pictures, but I would go through this with him. I would talk to him about the alignment of the spine, how the spine should have curves in it. Again, you know, you can do as much or as little as you want. I love educating patients that, you know, their X-rays we should see certain things. One of the things I like to see is a good cervical curve. It tells me how the spine's going to age. A good lumbar curve. Okay? And then I would go over his lumbar films, okay? And again, I would point out any asymmetries, subluxation, degeneration, any problems that I'm seeing in their X-rays. And then after that, I would go back to his overall grade, and I would say, Tom, that's basically how we came to your overall wellness grade. You can see we scored your X-rays down here in terms of the phases of decay or degeneration that you're having in your spine. So at this point, I would shut up and I would say, Tom, do you have any questions about what we went over as far as your wellness score? Sometimes they will, sometimes they won't. And after that, I'll basically say, Tom, there's a couple things that we can do here. Number one, and I learned this from Patrick Dentempo, I absolutely love it, we could do nothing. You could choose, even though your health is an F, you could choose to do nothing about it. Because this is America. I can't force you to do anything. But as your doctor, I recommend that you do something about it. And there's a couple options. We can patch this up. Right? We can do a patch care program, and I put that together for you where we just address your pain. because pain's always the last thing to come. It's usually the first thing to go. So if you want us to just address your pain, we're going to put you on probably a month or two of chiropractic care with your adjustments, and then we'll start to reduce the frequency of your care. But what I would recommend is that we really correct the underlying cause of your poor grade. And the underlying cause of your poor grade, as you probably know, is your lifestyle. And your lifestyle is a reflection of how you're moving and exercising, how you're eating, and how you're managing stress. And based on what I see here, we can certainly make improvements. So we have a program that I feel is perfectly suited for you because your BMI is a little bit high, your body fat's a lot high, you have no core strength and flexibility. So you're a perfect candidate because we need to get you in a program that's specific. So I would recommend 8 Weeks to Wellness. At this point, what I would recommend that you come to the 8 Weeks to Wellness orientation. We do that twice a month. The next one that we're going to do is this Thursday, at 7:30. So I would literally take him up front, get him scheduled for the 8 Weeks to Wellness orientation. We also use cash practice for our care plans. So this is the care plan that I put together, the patch care plan, which in Tom's case consisted of 20 adjustments and 20 rehab or personal training sessions. So we have 40 visits here at a cost of $1,275 for the first 2 months of his care. In our office, there's 2 ways to pay for that. He can pay up front and get 10% off the total care of the program. So it's $1,275, and if he paid up front, he'd get $127 off of that. Or he can pay over the 2 months of his program. So he'd pay obviously one payment up front and another payment after 4 weeks, and that would cover the 8 weeks of his care. And that's basically what we use cash practice for, and it's an awesome program. If you haven't looked into it, I would suggest it. It just makes it easy. It's clean. It looks good. We present this to the patient. And then from that point, I'm going to, again, just shut up and say, Tom, I'd like to really know what your thoughts are at this point. Do you want to do nothing? Do you want to just patch this up? Or would you really like to correct the program? Or correct the problem, sorry. So, and that's basically our report of findings, guys. Then once I get a commitment from the patient, whether they want to do nothing, they want to patch it up, or they want to do the corrective care program like 8 Weeks to Wellness, the longer term program, then what I'm going to do is walk them up front. I'm going to let the girls know, Patty, Tom has decided to do the patch care program, or he's decided to do 8 Weeks to Wellness, so we need to get him scheduled for an orientation. In your office, you may have year care programs, you may have 6-month programs, so you're just going to recommend, if they choose a longer term program, that's what you're going to recommend. If they've chosen to do the patch care program, maybe that's a month worth of care, maybe that's 12 visits in your office. I don't know what that is, but you're going to then let your CA know what they've chosen, because it's really important, I think, to hand the patient off to your CA properly. So you want to make sure a couple of things. Have they scheduled for their WOW? You want to make sure that you reinforce that, because in our office we start that process at the exam. The second thing you want to do is make sure that the CA knows what their financial commitment is. Maybe you have a financial manager in your office. I personally feel it's my job as the doctor to confront the really important things like money and their commitment. If I know they're committed, if they tell me they're committed, then guess what? They're committed, and I can tell the CA that. I don't leave that up to my CA to get their commitment. So those are a couple things that I think are important. Dr. Denise, did I miss anything that you saw?
Nope.
That you usually go over? No?
No, I was a little confused with just the patch care. I mean, basically we have patch care, we have a 3-month care plan, and we have 8 Weeks to Wellness.
Correct. Yeah, we do in our office.
Right.
But I'm using, for example, in our office, you may have a month or a 2-month. Some people, even for me, I had a patient in the other day, I can tell she was very, very allopathic minded. I knew she wouldn't even go for 3 months. So I recommended a month care program, because in my mind, if we can do a month and 12 visits, then at least she can come in, see what the office is all about. I think a lot of people in their mind, they think, oh, this person's going to sell me a bunch of chiropractic care, because they don't understand what chiropractic is. So if, and that's where the art of chiropractic and rapport comes in. If you see a patient is not buying what you're selling, you may want to sell something different until they develop that relationship with you. So in this case, I sold my care program, was a 12-visit care program over a month period of time. So even though we have our standard care programs in our office, that's the art of this, guys. You got to take a look at what the patient's needs are and make recommendations based on that. But in our office, we have an 8 Weeks to Wellness program, we have a 3-month care program, and those are generally the care programs that we're recommending in our office. So,
and having the cash practice to be able to edit that, and having the wellness score, I mean, those two things make the rest be very easy.
It's very simple system, guys. I love systems. I don't like ambiguity. You know, ambiguity creates a lot of confusion in your office. So the wellness score creates a very solid system for your patients to show them their physiology. It's not yours. You didn't earn it. They did. So show them what's going on in their body. You know, unfortunately or fortunately, however you want to look at it, I almost look at it as a fortunate thing in our office. People come in skeptical of chiropractic, and you have to be almost like an attorney convincing them of why they need care in their office. It's very hard to convince people of something if you don't have evidence. And to me, the wellness score is the evidence of why you're suggesting the care that you are. Because if you don't have evidence, then basically it's just subjective. It's your word. So, but if you have evidence, how do they refute their own x-rays? How do they refute their neuro-spinal functional index? How do they refute their body fat and their BMI and their functional movements? They can't refute evidence. So it's very easy to sell a person based on what they feel, not so much what they think. Because what they think is what they think about you in chiropractic. What they feel is what they see when they see that F. And when somebody sees an F, you know, it doesn't bring up really good feelings. It brings up feelings that, holy crud, I probably need to change this. So that's why I love the wellness score. That's why I love cash practice. Cash practice makes it so easy. Just what services are you recommending? How much is it going to cost? What's the time period? Put it in a really professional looking report and let the patient make the choice. And you'd be surprised. Our practice right now is 50 to 60% cash. We collect well over $1 million in cash in our practice. We have for the past 3 years, and every year we are moving more and more towards a cash practice. And it's thanks to the wellness score and thanks to cash practice, thanks to ChiroTouch and some of these resources and tools we use in our office that we create a tremendous amount of value for our patients. So I hope you enjoyed this on the reported findings, and we'll see you at the next training.